Articular fractures at the base of the first metacarpal, also known as Bennett's fractures, are relatively common finger fractures. They compromise the function of the trapezometatarsal joint, although it is the main joint of the thumb. As all articular fractures, they require surgery as soon as they are displaced. This day surgery is performed under original anesthesia. The patient is positioned comfortably on his or her back, the hand vertical, the thumb under axial traction. Only 4 incisions smaller than 2 mm are necessary, 2 arthroscopic incisions, 1 posterolateral for optics, and 1 anteromedial for instruments, and 2 more distal ones, determined previously at fluoroscopy, which will make it possible to position the 2 screws for osteosynthesis. The joint is entered through the posterolateral portal. The trapezium is visible below, and above, the first metacarpal, whose fracture is clearly visible. The latter is displaced, but already partly reduced by the axial traction applied. Through the instrumental portal, the hematix synovial membrane can be evacuated, making the fracture more visible and post-operative pain and inflammation easier to reduce. Once synovectomy is completed, reduction is achieved by means of the trocar that exerts pressure on the base of the metacarpal bone. The cannulated screws are then positioned under axial traction and checked at fluoroscopy. This is the result at arthroscopy, with perfect reduction and satisfactory compression of the fracture site. The 4 micro-incisions are closed with Steri-Strip and will not require any suture. The post-operative X-ray shows perfect positioning of the osteosynthesis screws, which are buried and will not require secondary removal. A splint must be worn for 3 weeks. Daily activities can resume at 3 weeks, and rugby at 2 months.